I am here with hair expert Kelly Morrell at the private clinic on Harley Street. Thank you,
Hello.
Kelly.
Pleasure.
Thank you so much for joining us. Now, Kelly, this area of hair is a bit of a
Mm,
minefield.
mm,
I've been doing some research, obviously, for this episode, trying to find things out. So I'm really grateful to be able to come here today and for you to give us your time to chat
mm.
about all things hair. So, where I'd like to start, if possible, is the whole thing around hair and DNA testing.
So yes, we do something called tracker test, which is a genetic hair test. It comprises of a simple swab of the inner cheeks. It's the samples then sent off to the lab, um, and it analyzes 7 different receptor groups, 48 different genetic receptors based solely on hair loss. Can help determine what is the best course of action and course of treatment and also long-term management for your specific type of hair loss. Where I think it really comes into its own is I have some clients that come to me where they've been to maybe many other clinics or trichologists or dermatologists around and found that nothing has really worked or helped, and they're still having the same kind of hair loss and they're not finding it's got better. Um, Stable is better than nothing, but definitely, when it's worse, it's not good. And one example I can think of straight away, a guy went on, I think he was like 2 years into treatment. So he was using various solutions on his scalp. He was on quite a high percentage of quite a, a typical kind of first line therapy, which is minoxidil, one of many, and a few other things. And it wasn't working. And he kept saying, I've spent all this money and it's not helping, it's not getting any better. I feel like it's getting thinner if nothing else. I would like to try PRP and I'd like to try this and I'd like to try that. And I said, well, before we go any further, maybe this is something we should try, because he'd already spent thousands and thousands of pounds and it could save him a lot of time and money if we did this first, just to see where it was at. And his test report came back and we went through it together, and his the receptors for minoxidil were never going to metabolize the therapy, the medication, so it was completely pointless in taking it. But then it marked a few others that he could use instead. So and it did also tell us that PRP had a good chance of working for him, so we developed a bespoke treatment plan. And yeah, his before and afters are incredible. So that's when it really comes into its own, I think, for people who have tried what they feel is everything in terms of traditional first line therapy and found it's not worked. And, like many people, don't have a sort of an endless budget and want to spend their investment and their money wisely in what treatments they do decide to go with.
Yeah, well, thank you for sharing that because I think that's the thing. If you have obviously, if you're losing hair, hair is very personal. Yeah, maybe a big part of our identity, and you then go and spend money on it, and then if it doesn't work, it's obviously by the time then if you're seeing somebody at that stage, I mean, if you said 2 years he was trying something, I mean, that must have been probably at that point very emotionally charged as
Yeah.
well. So that's incredible, really. So with the DNA testing, so would you, in your experience with all the people you've treated over the years, would that kind of be your first point of call then for almost anybody coming in before you would recommend a treatment as such?
Uh, yes and no.
Okay.
So it depends a lot on the type of hair loss that they are suffering with, and the causes and everything. I mean, if it's something like postpartum hair loss, so the typical kind of hair shedding that happens after one's had a baby, then that tends to correct itself. And if not, there are things you can do, and it's got a high percentage of working, and it's reliant on sort of the hormones kind of rebalancing and things kind of rebalancing within your body. If it's something like alopecia areata, where there's small patches of loss, or for some people, quite large patches of loss that appear, that's either severe stress or normally autoimmune disease. And that, again, is a different line of treatment. And the things tend to work. There are certain things that dermatologists would use specifically for that type of hair loss. So even with that, it can tell you, for example, anti-inflammatories, which ones would be better and more advantageous for the client, I think, than some. But those are the kind of things I think, well, maybe it's not necessary. Again, there's no reason why they can't. But with most other types of hair loss, like male and female pattern hair loss, something called telogen effluvium, where the hair is just shedding, they're definitely things I think will that having a trichotest first will definitely shed a lot of light on things. It's a really good way of saving time and money in the long run.
Can I ask you, when somebody comes into you, do they normally have a good idea, do you think, of why they're losing hair? Or is it more something that you kind of discover really when you're talking with them and you explain more about certain things?
A bit of both.
Yeah.
So some people um, are kind of long-term sufferers of a type of hair loss, and they kind of over the years have done a lot of research purely because they've had to. Other people, it might be the first time that they come and sort of even talk about it, and they've done a lot of research, and they come in, and they've kind of got in their mind what they think they've got and what they think they need. And then other people that come in and they just go, "This has happened to me, help," But quite often, especially with ladies, I get a lot of people that have never told a soul before, um, and a lot of the consultation, or at least the first kind of half an hour of it, is them kind of almost releasing the anxiety and the emotion around whatever they feel about the hair loss. And then we get on to maybe what it is and why it is after. But
Yeah.
yeah, it's definitely emotional for most people.
Yeah, so it's really listening to you is really highlighting to me that the importance probably of that moment of coming in and seeing somebody, because when you are looking online, there is so much information out there. It's almost impossible to know, is this good information? Is this bad information? You brought up about, I think you mentioned minoxidil.
Mm.
So this is a medication, is it, that people can take?
Yes, so it's quite a kind of well-known, well-established medication. It's topical or oral medication. Oral is less common, really. Most people would know it as Regain or Rogaine, and then higher doses, obviously, within clinics and dermatologists. I mean, the gentleman I mentioned about earlier that had spent like 2 years and thousands of pounds. He started off on quite a sort of a basic low dose that you would get maybe in a pharmacy over the counter, and ended up on something like 10 or 12% on a private prescription, and it still wasn't working. So
That's a
that's
very
when
strong
that
prescription, is
yeah,
it?
most people are on sort of 4 or 5%. So he'd gone, to 7, to 9, to 10, etc., and it still wasn't working. Hence the Tricher test showed up that it was never going to work for him, even if you could get 20%. It was never going to work. But yeah, it's for many people it works very, very well. But, like a lot of things, it's not a one size fits all.
But is there a danger in that self-diagnosis as such, and then getting that?
Um,
Like, have you seen any cases, any patients who've come in who have had themselves on some strong medication with some bad
yeah,
side effects?
a number. So I have a gentleman that I've treated who sort of did some research online, got a kind of a prescription in the post, and started using some topical medication, and it actually made his hair worse. And he's obviously spending a lot of time and money to kind of help correct that kind of the shock to the hair. And unfortunately, you can lose it like that, but getting it back takes a lot of time. So, whatever treatment that you do embark on, whether it be an in clinic treatment, professional treatment, or um, like a over the counter medication or something topical at home, it does take, because of the hair growth cycle, it does take a good sort of 6 months to really see how truly beneficial it's going to be for you. Um, and yeah, it takes like 5 minutes to lose it. So um, I think he thought by trying this medication, quite strong, again, it was kind of sent in by the post. So there was no face to face clinical consultation. And yeah, it didn't go well. And I've known other people that have tried medication because it's an accepted kind of treatment that everybody kind of goes to. And he didn't react particularly well with it at all and ended up in A&E. He's fine,
Yeah,
completely
but
fine now.
but this is not
But
something that
yeah,
I would be thinking, "Oh, if I take something for my hair, that I could end up in
yeah,
hospital."
yeah,
And
yeah.
I guess this is
Then that is an extreme case.
yeah,
Obviously, not everyone ends up in
but
hospital,
it can
but that is an
happen.
extreme case. Yeah,
Yeah. I mean, it is fascinating. Are there any other side effects? Just if somebody is out there watching this and thinking, "Oh, I was thinking of taking minoxidil or finasteride," are there side effects that people need to just be aware of?
there are, especially with finasteride, and lots of men take it absolutely fine without any side effects. It's considered again a traditional gold standard first line therapy for hair loss for men. But if you're unfortunate enough to get the side effects, then yeah, they can be quite debilitating. For a gentleman, it can be loss of libido, erectile dysfunction, chest pains, man boobs, psychological issues like suicidal thoughts, depression. I mean, there's quite a long list. But I've known people that have been on finasteride for years and they're absolutely fine. But I think with like anything, really, rather than Googling it and then just getting something from pharmacy in the ether, maybe going to see somebody and actually discussing your options and a full range of options um, is more,
Yeah.
is better, more beneficial.
Yeah, because I feel like things like hair transplants get a lot of have a lot of awareness. A lot of people
Yeah.
know about hair transplants, but maybe they look into that and the cost. It's obviously an operation, but
Mm,
it's also quite a
mm,
significant cost.
yeah.
So so it's really good to first of all hear that there are other treatments. So what else would you kind of be maybe recommending to people,
So
patients?
hair transplant are definitely, excellent if you get, a surgeon you feel really comfortable with who's, experienced, brilliant. Um, but, there are degrees of suitability, in terms of age when you have your first one, how much hair loss you have, et cetera, et cetera. And how much donor area you have, so how much hair you have left to take from. So there are things like PRP, platelet-rich plasma therapy, which uses your own blood. So it's a bit like having a blood test. For anyone who doesn't know, they take a vial of your blood, spin it in a centrifuge. It separates the platelet-rich plasma. So it separates the components of the blood that we need, and then it's injected, micro-injections back into the scalp to help with hair loss. Something like Calisim, Advanced Hair System, is a similar thing. So it's using growth factors, proteins, cytokines, exosomes, but instead of using them from your own blood, it's actually derived from an external source. It's derived from New Zealand red deer.
Oh wow, okay.
No deers were harmed in the harvesting.
Thank you
Any
for
vegetarians
clarifying.
and vegans out there. It's from the umbilical cord lining and it's from the waste part. So after the cord is cut, one syringe full goes on like 3 billion stem cells, and it goes from there. And there's no direct DNA in what you're using. But yeah, this lovely serum is packed full of exosomes and proteins and growth factors, and that's ideal when maybe PRP isn't um, maybe suitable, whether there be an underlying health condition. There are all sorts of things. I think with using your own blood, that are more variable. Your health, your hydration, etc. Whereas when you're using an external source, for example, I choose to use Calisim. Um, there's in every bottle there's a potent dose, so definitely there's no limitation on what you've extracted that day. There it's scalp micropigmentation, so
So you're a bit of a
there's
specialist on
yeah.
this, aren't you? Yeah. So I have
So
like,
we
what is
have
this?
that, essentially tattooing loads of
Okay.
dots on your scalp.
Yeah.
So it uses a medical grade ink, and we tattoo across the areas that we're trying to disguise on the scalp. And it's done over several sessions, kind of to build up what essentially looks like a greater density of hair. So it doesn't give you any more hair, but it gives you the illusion of more hair. Using like follicle stimulation, you're trying to stimulate other follicles present on the hair or the scalp. So yeah, it's good to cover, completely. bald heads, and it's also good to cover little patches, or maybe, touching on hair transplant. Maybe someone's had a hair transplant or two, and they've gone as far as they can go with that, but they want just that tiny bit extra kind of density look,
Mm.
that illusion of a real thick full of head of hair, then scalp micropigmentation is good for that.
And is that, like, does it last a long time or
So it's longevity depends on lifestyle and sun exposure. So it's between 3 and 5 years, maybe as long as 7,
okay.
maybe as little as 18 months. It depends on what else the person is doing and their lifestyle. So we obviously ask for them to maybe not, if they've, especially if they've got a full head of it, not be in the sun too much, or use an SPF like a powder to cover, or a hat in the sun. But obviously you can have it refreshed at any point as well.
Yeah.
I mean, I knew people, as like one of the
Yeah.
first ladies I ever treated, she had a scarring hair loss issue, and she'd lost over 80% of her hair. So, there are a lot of things that PRP, calcium, hair transplant, they just were not an option because there was nothing left to work with. So she was ready. She didn't want to wear wigs anymore. She was ready to kind of rock her look.
Yeah.
And yeah, we did her forehead, and she looked amazing. And she has on her
Amazing.
lipstick and her big earrings, and she looks incredible. Um,
Amazing.
but that was 8 years ago, and it's like I don't know whether how it is, and
Yeah.
so I contacted her to say, how is it, like, does she need a retouch? And she said, no, it looks amazing. It's still looking good,
Oh, wow.
which is great.
Ama
Then that's 8 years, but then other people might need a refresh after 3. It depends on
and
what you do and your aftercare.
I mean, but that sounds life-changing.
Mm.
So, I mean, I think this is was for me has been fascinating to learn about, just how, yeah, life-changing it is for people who, yeah, in
Yeah.
these, yeah,
And
desperate.
even things that maybe I cannot do, but the importance of seeing somebody quite early on. So I had a lady who came to me who I thought she had been told by a different specialist that she possibly had female pattern hair loss. And I was looking at it thinking, well, it looks like a scarring form of alopecia to me. So I referred her on to a dermatologist colleague of mine and said, look, I think she should see you. And indeed it was. And then she got the correct treatment from a specialist dermatologist. And again, she could have easily gone down the road of, oh yeah, we'll just use this on you because that's what it is, and incorrect diagnosis, wrong treatment, etc. So yeah, it's
Yeah.
definitely.
So can I ask, you mentioned female pattern hair loss. So what
Mhm.
exactly is that?
So no, it's very similar to the male pattern hair loss. So there's some things, so we have lots of androgens present within some of our follicles in our scalp, and there's a particular one that she's quite sensitive. So we all have male and female elements, different, sorry, not elements, different amounts of estrogen, testosterone, etc. And as women, we still have a certain amount of testosterone and need a certain amount within our bodies. But in male and female pattern hair loss, it's the testosterone present within the follicles that get converted to dihydrotestosterone, which anyone who's done their research will know as DHT, nitrogen CHT. And this kind of almost like attacks the follicles and causes them to miniaturize and eventually stop growing. And it's the same DHT kind of production and conversion in women and men. It's only present in some follicles, not all of them. So hence why guys can bald sort of on the crown or the front, but not the sides and the back. And with women, it's similar. You can kind of go at the crown, but it's mainly the front. So it tends to be kind of like a circular patch or visible as a wider parting. So it's a similar cause, and equally as distressing for men and women. Um, Unfortunately, there's for women of childbearing age, there's less available, because the things we talked about earlier, like finasteride, for example, you shouldn't use unless you're really ideally, unless you're postmenopause, because of risks to, them maybe finding out that they are pregnant whilst on this medication. So we would look at other options.
Okay.
Yeah.
So for now, in terms of looking at the kind of people's individual stress, their nutrition, lifestyle, how important do you think this is in relation to your hair?
Incredibly important. Yeah, incredibly important. So stress affects hair. We have stress receptors in our hair as well. So um, yeah, I do see a lot of people that have, especially go through a lot of stressful kind of periods in their life, they can develop like a sort of an intense shedding of hair loss. Or alopecia areata, which we spoke about earlier, which is the patches coming. I had a lady who was getting bullied at work, severe bullying at work, and she developed this hair. She said, "I've never had hair loss in my family, never had hair loss in my life." Unfortunately, she changed jobs and removed the stress and work
Yeah.
on meditation and relaxing. But yeah, I mean, like anything with our skin, our hair, if we haven't got the right vitamins, too much stress, it will tell on your body. It takes its toll, and you can see it in your eyes, your skin, your hair. Um, a lot of people come to me and they are experiencing something, but they're not really sure quite what. And you dig a bit deeper and maybe order some blood tests, and there's an iron deficiency or a vitamin D deficiency, or there's just something going on underneath. Which again, if you address that, um, it helps.
So does sometimes would supplementation simply work? Just
Yeah,
that step?
a lot of people, maybe they've got really low iron, like really sort of insufficient iron, and just getting their iron levels back up already does a lot. I mean, there are things that you can do to help, but even just that alone will help. Will do something. Yeah.
And do you have any tip where then you could get so if somebody stops suffering from stress,
Yeah.
I find the thing is, oh, if you're stressed and then somebody says to you, oh, and now this stress is causing this, and then you can feel more stressed about the stress that you've had. And
Yes.
so I mean,
Yeah.
what can you offer any advice on that? The Holy Grail.
I wish I could. I think maybe an interview with a psychologist would definitely help as well, or a yoga like expert. I mean, yeah, I obviously advise trying to get on top of stress and good sleep, things like that, yoga, something to help, whatever even just a nice walk in the park in the sunshine can help one feel better. But yeah, I mean, I do tend to sort of advise when they're stressed, either trying to reduce the stress in their life. A lot of it is not possible. It's family, it's job, it's something that you just can't go, I can't do this anymore and leave, because life's not like that. But yeah, I mean, managing it somehow, whether it be time out for a hot bath, you walk in the park, a yoga.
Or coming in and have you listened to them? I imagine this is,
Yeah, sometimes that helps. I have had people before say to me, "I don't know what I'm going to do when treatment's over and I feel better because I'm using you as a therapist." And then I have
Yeah.
actually a client who has never told a soul about their hair before and how much it bothers them, and they say I just come in and I just talk hair for well over an hour, and I have no one else to talk hair to. And it's like, well, hopefully you won't have to talk hair, continuously. Hopefully, when you feel better about it and it's improved, you feel, the necessity isn't there.
Yeah.
But yeah, having someone just to, let off steam about or just open up to.
Yeah. I mean, in kind of researching for this episode, what I found interesting talking to particularly to women, that they, that when you start talking about it, they will often say, "Oh, I thought it was just me,"
Yeah,
or
yeah,
"I don't know if it's my imagination," or and then maybe they're afraid to even look closer because they then think, "What if I find something?" So I feel like, listening to you, and what I've been looking at, it feels like prevention is easier than
yeah,
cure.
Yeah.
So,
Yeah.
or, you know, that if we can be proactive. Um, so, like, do you have any tip on what might be like a first step if you're starting to notice that you're kind of a little bit worried, maybe not even realizing
Mm.
you're a bit worried, but you are noticing it to a point, or maybe somebody shows you a photo of you of them from 5 years ago, and you suddenly think, oh my,
Oh
oh
my
my,
God.
yeah, you know.
Yeah.
So
Yeah.
would you have any advice to someone when they're in that situation?
Yeah.
Um,
I mean, you touched on the perfect thing there, sort of prevention or seeing someone as early as possible because um, like anything with our health, the earlier you see someone, the more options will be open to you.
yeah,
And if it gets past a certain point, then there'll only be certain things, i.e., I'm really sorry, transplant your only option or something like that. Whereas if you can get it a little bit earlier, it will help. And yeah, with stress, I mean, especially opening up, quite often people do suffer in silence, about hair loss, about lots of things. And I suppose if you can find someone that you feel you can talk to and they are saying, you can hear them say to you, well, just go see someone because you might think, well, I can't go. It's not like I'm bored. Like I don't like I'm probably worrying about nothing, but opening up to someone and someone saying, actually, you know what, if you're that worried, just go and see someone. And if it's fine, it's fine. If there's a little something you can start to do, blood test for supplementation and levels of iron or vitamin B12 or D or whatever, or, you know, some like very small thing that you can do early,
and
then it's definitely
like, is there, and then for people who are really looking to be proactive, is there an advantage, say, to doing a DNA, like the tricho test, kind of knowing basically your own makeup, so that
um
for intervention or
yes and no.
something like that? Yeah,
Yes and no. I mean, I think if you're genetically predisposed to something, like if you carry a gene for anything, doesn't mean to say you're definitely going to develop that condition. We all know, things can jump a generation and get passed down to grandchildren, great grandchildren, etc. So I think with some people it might make them worried, like,
yeah,
oh my God, my test results say this, and then they're worried about that might happen, or something quite minor will turn into something quite catastrophic. So yes and no.
mm,
I think things again. I think when you see somebody, a trichologist, dermatologist, hair surgeon, at an early stage and get their professional advice, either you really don't need to worry, or supplement with this, and you'll be fine, or let's start you off on a low dose of something, you'll be fine. As opposed to no, actually, we need to look at this a bit more seriously. But at least knowing
yeah,
um, yeah, so I think we can't have hair in our 60s and 70s, the same as in our 20s. So there's a little bit, yeah, I would. Well,
oh,
although we don't, ask me again in 10 years' time, it might be
okay,
different.
I will.
So, I think expectations have to be met a little there as well, because I think with a lot of people, especially if it's a lady and she's past the menopause, the hormones are different. There's a lot of different things going on. And yeah, there's you would you don't necessarily have that kind of full bloom of mane in your 20s,
Yeah.
at 50 or 60. But in saying that, I do know a lady who's about 69 and she's got incredible mane of hair. Don't know what she does. There you
Yeah.
go. I should ask her.
Yeah.
I should ask her.
Yeah.
Yeah. So
So, because speaking of, I did want to ask you about, any myths or misconceptions that you find you hear a lot. Too many?
I've heard quite a scary few. Um, I do know a lady that was told to mix like boil potato skins and pop this whatever the starchy sludge left in her hair, and yeah, there's all sorts of things. Just like, why would you even go along with that? Um, yeah, I don't know. I mean,
What's the craziest thing you've ever heard somebody trying though?
Probably that, actually, probably that. A lot of people use, oils and things like that, and I know that obviously having your hair conditioned and not dry does help, but yeah, don't be oiling potato skins and putting them in your hair.
Okay, nifty.
Please don't. Please don't. So,
Uh,
yeah, and then, recently I had a consultation with a client, and they've been to it's funny enough, they're not a native Brit, and they've been to um, a specialist in their sort of home
yeah,
country, before they moved to London, and there was some kind of concoction of like serum that was going on their scalp. And when I looked it up and sort of looked it up in English, I was thinking, like, there's nothing there. And he said, I don't think it's working. I'm thinking, well, it's not going to. There's nothing in there. It's just some nice smelling serum, which is, quite fancy. I might put it on my hand with a nice hand cream serum or something. But yeah,
yeah.
yeah.
I mean, so that is a challenge, I think, for all of us as consumers out there buying something, how something can look nice, smell
Well,
nice, and
yeah.
yeah, and it does nothing. So but speaking about that kind of a more kind of global, where somebody is thinking about procedures or treatments
Mm.
and they're looking online and they see that, oh, some country I can get this done for a fraction of the cost. What's your advice on this? Mm.
Do your homework.
Yeah.
So there's, especially with hair transplants, a lot of people go to, there's a certain few countries in particular that it's quite well known if you look it up, um, that people are going to get a hair transplant because it's a fraction of the price, like you say. Um, and it's not to say that everyone in this
Yep.
particular country that you might choose is bad, or they are not qualified or not experienced, and there are no good surgeons. Of course, there are some great surgeons around the world, um, and I've met some of them, and they're amazing. Um, but it's when you're here in the UK and you don't speak the language, you're not a native, you might not know a soul in that country, and you're picking something from a website that looks fancy and it's an attractive price. You can get a week somewhere lovely and warm in a really fancy hotel, and it's not even like £2,000 when a good surgeon with the same kind of surgery here in the UK is maybe 7,000, £10,000. I can see why it's attractive, but we have here in the private clinic, we have had some patients come in, and we've had to fix things where they've gone wrong, or that it's just not worked and it's not worked out. So yes, there were some great places out there, but I think if you know somebody local within that city or town, that helps. If you speak the language, a friend or family member that can help, might make some calls and get a feel for if they're a really professional and reputable clinic or not. Um, but yeah, and if it's too good to be true, it probably is. It's that old-fashioned saying, if it seems like such an amazing deal and it seems too good to be true, then it probably is. So my thing would be to try as much as you can, research the clinic, try and find good, honest, real reviews. I know it's hard because people put up fake reviews, but try. Or maybe if you are open about talking about your hair loss problem, try and see if there's somebody who's been to the same surgeon or clinic who has had a good experience where it's clean, it's professional, um, and that maybe you can get some consultations via video with the surgeon and get some reassurance that the surgeon is doing the work and not the technical team. Um, because the hair techs around the surgeon are amazing, but they shouldn't be doing the transplant. And quite often you think you're seeing a surgeon and it might be the technical team who are not qualified, and are not should not be performing the surgery. And then, it's seeing if that country has our equivalent of CQC, which is the Care Quality Commission, which is what we're all kind of like governed by. So it checks the hygiene, cleanliness of the facilities, the way you carry out everything, your documentation. Like it's we all have to report in to this governing body to ensure that we are ethical and clean and professional. So if that country has a similar thing, are they registered? There's a couple of really good places, I think, if you are looking to go abroad. The international, I'm going to get this wrong now, aren't
Yeah,
I?
we can put up the links,
So
yeah,
yeah,
underneath,
yeah.
yeah.
So in the UK, it's BARS, the British Association of Hair Restoration Surgeons, and you've got the International Society of Hair Restoration Surgeons. So yeah, I can even send you some links. So anyone who's reputable and experienced and you know
Yeah.
will perform a good surgery, hopefully for you, but definitely a couple of different video calls with the surgeon, ensure that they will definitely be performing the surgery, get a feel for if you can trust them. Because I think when you meet someone, at least here in the UK, you go to a consultation and you're thinking, do I want this doctor to operate on me? Do I feel that I
Yeah.
can trust him or her? And that alone I think says a lot as well. But yeah, just try to do your homework.
Okay, well, thank you for sharing all of those tips and also for that advice. And we'll definitely put the links up as well underneath. So one thing that really strikes me when you're, talking about this and the way that you do things here is that you're not in one sense working alone. So you have kind of people who, if somebody needs this or somebody needs that, and
Yeah.
that seems to me like
Yeah.
the ideal
Teamwork.
scenario. Yeah.
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 And so for your patients, then they can have the best
Yeah, of
experience.
course.
Yeah.
I mean, people, that come to me think maybe they want micropigmentation or maybe they want some PRP or calcium or something. And actually, when you meet them and you start talking to them, what their needs are in terms of how progressive their hair loss is, in terms of what they expect and what they would like, their heart's desire. Sometimes maybe they don't need what I do, and they need to have a hair transplant to give them that, what they want, or maybe they're so far gone that what I do is not going to work for them. Sit there, then I see, you
Yeah.
sort of share your expertise as a team, which is really good.
Yeah, that's really good. You mentioned earlier just about how for females there can be slightly less options
Mhm.
sometimes because of, say, pregnancy or
Yeah,
various things. So I'm definitely excited to hear that it
yeah,
feels like females
yeah.
are being included
Yeah,
more in.
finally, finally,
Yeah.
yeah. There's a lot of there was a sort of big void in research, so there was a load of research around, and some, kind of some of them by accident, a lot of kind of treatments and medications based around men, because it was quite, I think, widely accepted in society that men lose their hair, they go bald. It's, it happens to most of us, and it's fine. And then women were kind of left going, actually, we experience this too. And yet a lot of the medications are not safe for, pregnancy and ladies of childbearing age. So to have research finally now in that area is amazing. Yeah,
Amazing.
again, watch this
Yeah,
space.
watch this space. Well,
Watch this
listen,
space.
I look forward to coming back and chatting to you again, Kelly, when maybe there'll be more to, yeah, on this
I
subject.
hope so.
Yeah,
Who knows?
yeah.
But not for a good few years.
Okay, well, there might be other
Yeah,
things in the
yeah,
meantime.
yeah.
Well, listen, thank you so much
Thank
for
you
taking
so
the time.
much. It's a pleasure. Thank
Thank
you.
you, Kelly.
Thank you.